Hello viewers, my name is Shoma Cynthia. I'm a student of biochemistry in the University of Uyo. I and my colleagues are here to talk on a disorder of pyrimidine nucleotide metabolism. So I'll be defining the basic things. First is the first is uridine. What is uridine? Uridine is a nucleotide composed of the base uracil linked to the sugar ribose. Uridine consists of uracil and ribose. And the second one is the pyrimidine. A pyrimidine is a heterocyclic aromatic organic compound that forms the foundation of various biomolecules, including nucleic acids such as RNA and DNA. Now I'll be talking about the disorder, which is the uridine monophosphate synthase deficiency. And what is it? It's a rare genetic disorder affecting the pyrimidine nucleotide metabolism. It is caused by mutations in the UMPs gene, which encodes the enzyme UMP synthase. Thank you.
In the biochemical background of uridine monophosphate synthase deficiency, a disorder of pyrimidine nucleotide metabolism. The UMP, the uridine monophosphate synthase, is a bifunctional enzyme that catalyzes two consecutive steps in the pyrimidine nucleotide metabolism. 1. Orethidine 5' phosphate decarboxylase. 2. Orethidine 5' phosphate phosphoribosyltransferase transferase. This reaction converts orotic acid to uridine monophosphate in the pyrimidine biosynthesis pathway. The pathway is essential for the production of pyrimidine nucleotides, which are the building blocks of nucleic acid, that is the DNA and the RNA.
We're talking on the treatment of uridine monophosphate synthase deficiency. First, I'll start with dietary management. Now, we can use low protein diet to reduce orotic acid production. Secondly, we have uridine supplementation. We can use oral uridine to reduce or to bypass the defective enzyme step. The third one is supportive care. Now, we can manage the seizures, infections, and hematological abnormality.
Hi viewers! Okay, so I'm here to talk about the diagnosis of uridine monophosphate synthase. So, the first one is the urinary uric acid measurement, which is the elevated levels of uric acid indicates the presence of UMP synthase. So, for the we also have the enzyme assay. This is the use of enzyme to indicate that there is UMP present. So, UMP activities are being measured in the red blood cells and the fibroblasts. Okay, so we have the molecular analysis from the word analyze to check out things. So, molecular analysis, UMP gene sequencing can also indicate that there is UMP through the diagnosis. Okay, so I'll also talk about the prognosis of UMP. Variable severity. Symptoms can range from mild to severe case when it is not being treated. Also, we have the progressive disease from the word progressive, getting to a higher level. Like most of us now, if we have malaria, we will not treat it. We will be managing it to making it to get to a higher level. So it's also applicable to this one. When it's not treated, the disorder can lead to severe intellectual disability, growth retardation, and increased mortality.
Hello viewers, I'm here to talk about the consequences of UMP synthase deficiency. Now the first consequences is orotic aciduria. Orotic aciduria is when there's too much presence or elevated level of orotic acid in the urine. This can be caused when the enzyme, which is UMP synthase, cannot convert orotic acid to UMP. Since it can't convert orotic acid to UMP, it causes an increase in level of orotic acid in the body. The second thing is growth retardation. Now, once there is deficiency in this enzyme, it reduces the rate of growth of cells and tissues. The third consequence is intellectual disability, cognitive impairment of developmental delays. The fourth consequence is seizure, recurrent seizures after resistance to treatment. The fifth consequence is hematological abnormalities, which is anemia, thrombocytopenia, and leukopenia.
So in conclusion, the uridine monophosphate synthase deficiency is a rare but significant disorder of the pyrimidine nucleotide metabolism.
Early diagnosis and treatment